some new research suggests the NFL should change the way it cares for players.
It's a conflict of interest, Harvard researcher Glenn Cohen said, to have the doctors that oversee the health of football players work for the teams.
We get our health care from a doctor who is devoted to us. That's not true of NFL players and its status quo.
He worried about a team doctor pressuring an injured player to return to the field, though the report mentioned no instance when a conflict actually materialized. The authors suggested splitting medical care into two groups, one loyal to the player, the other to his team. The NFL called that untenable and impractical. Aaron Katursky, ABC News, New York.
We get some reaction tonight from Philip Stieg. He's a neurosurgeon with expertise in skull-based surgery. He's chairman and founder of the Weill Cornell Medicine Brain and Spine Center, and he is paid by the NFL to be on the sidelines for New York Giants games to check out players for concussions. He tells us he doesn't work for the Giants and doesn't have to answer to team leaders when he decides whether a player should stay out.
All I can say to you is that my clinical judgment has never been challenged by one of the team physicians or the athletic trainers. So I think that people that are making those statements, they're not involved. They don't understand. What's more, I think that most of the unaffiliated physicians that I know working on the sidelines, we have day jobs, and we're not paid that much for working on the sideline. So I would submit to you that it is not worth my earning potential nor my reputation to make some foolhardy decision to make a team doctor happy. There's some implication that we're going to give in to what we think is right for the player. That just doesn't happen. We're not put in that position. It has become an extremely collegial environment where we, the team doctors and the unaffiliated doctors, are working together trying to make sure that the players are safe.
So no matter how evil a stare you get from the head coach or somebody else on staff, if you don't think a player should go back in, you're going to stick with that assessment, right?
What would I rather tolerate? An evil look from a head coach or sending a player back in and they have a serious accident? At the end of the day, I think that I would rather tolerate the former rather than the latter. Yeah, I know that there's been a lot of controversy about this, but the NFL and the officials have really clamped down on the helmet to helmet and some of the contact that leads to increased brain injury.
You know, it's an inherently violent game, but we're trying to prevent injuries, and some people would say that's a foolish endeavor, if I could put it that way.
I think we have to put it in perspective. Quite frankly, the number of concussions that occur in women is higher in soccer than it is in football. Hockey is another game where there are a significant number of concussions. So I think to focus only on football is, in my mind, there's an agenda other than what we're really trying to seek here, and I hope that that's the truth. Yes, it is a violent game, and now that everybody fully understands the implications of that violence, the rules have been changed, and we will hopefully see that the potential longer-term effects of that violence will be ameliorated. There's so much emotional behavior as well as psychomotor skills that are developed as a result of playing these sports that we can't just completely eliminate that. If your kid is hell-bent on playing football, you're going to have a hard time stopping them. Then I think as parents, it's incumbent on us to make sure that the coach and the trainers in whatever league, the Pee Wee leagues, understand the implications of concussions and aren't doing stupid things. And I think we're not there yet, but we are making progress in those arenas as well.
Dr. Stieg, if I can direct us back to the NFL, it was announced fairly recently that another pretty sizable chunk of money was being devoted to not only concussion research, but maybe some new helmets. It's my understanding, and you're the expert here, obviously, that any kind of helmet really can't protect the brain from sloshing around within the skull. Do you see any promise in helmet technology being at all helpful here?
I think that helmets will provide some protection, but the reality of it is a concussion in football is most likely from what we call a translational rotational injury, where your brain, which is suspended in water, is shaken around within a solid structure called your skull, and it wasn't designed for that. The helmet will reduce some of the impact, the direct blow, but it's not going to significantly reduce the torque forces that are the result of the contact. I think we have to remember also that these players, they're 6'6", 340 pounds, and they're running 4.4 40-yard dashes, They are big and they are powerful. So it's going to be more behavioral than it is helmet.
Someone like you is probably always going to be needed on the sidelines. The idea of eliminating concussions, does that seem far-fetched?
Yes. Again, just think about the overall incidence of concussions is probably about 3.8 million in the United States, and many of them go unreported. I'm sure you've seen it. I have videos when I give talks on this subject. The freak accidents, a girls' basketball game, two girls collide with each other, they fall down, they smack their heads on the floor. Heading in soccer is now being reduced until kids get to be 12 to 14 years old. Checking in hockey is going to have to be changed. And the helmet-to-helmet contact in football is being changed. I think where it's going to be most difficult is obviously at the line where the players are immediately contacting each other. There's just a lot of secondary episodes where it happens. So yes, I will always be needed.
Neurosurgeon Philip Stieg on Skype. He's paid by the NFL to stand on the sidelines and examine New York Giants players for concussions, and chairman and founder of the Weill Cornell Medicine, Brain, and Spine Center.